28th meeting of the. Please stand and join me in the pledge.
To the flag of the United States of America, and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice.
Have a motion to adopt the agenda.
I move that we adopt the agenda as proposed.
Have a second. Second. Any discussion? Anyone have any additions? Hearing none. All those in favor? Aye. Opposed? Motion carries. I also have a motion to approve the minutes of February 14th.
So moved. Second.
Motion and a second. Any discussion? Hearing none. All those in favor?
Aye.
Motion carries. Item 4, public hearing on amendment to chapter 278 taxation of the Code of the Town of East Hampton regarding providing additional tax relief programs. Will this be a public hearing? If anyone has any comments about this, please step up to the mic.
At what point, Mr. Chairman, would you like me to run through the 2 or 3 suggested changes that I have?
You can do that now for the people.
Okay. As you have been discussing for some time, the proposed ordinance implements many of the optional tax programs available to the town through the state statutes. One of those is a benefit for surviving spouses of police officers, firefighters, and emergency medical technicians who die in the line of duty. After a lot of discussion by the council, it became clear that the council wanted those individuals, I'll refer to them as public safety professionals, wanted those individuals to be able to receive that benefit, or their spouses to receive that benefit whenever they were performing their duties, whether they were on duty or not. This is involves the conversation of what I'll refer to as a simple commuting to work death, although that's never a simple thing, but as opposed to you stop and you perform your duties to aid a motorist, to intervene in a crime, whatever the case may be. So I have proposed to the council amendments to the EMT duties, the fire duties, and the police duties rather, to add at the end of their phrases, for example, in EMT duties, while in performance of medical rescue services for which the EMT is licensed during times when not on duty. So it's both on duty, and then that second sentence clarifies that we also intend that when they serve off duty or use their services off duty, that professional. Similarly, firefighters, when performance of firefighting or rescue services for which the firefighter is certified during times when not on duty. And lastly, for police officers, it describes in the paragraph any actions that a police officer is obligated or authorized to perform, whether they're getting paid, when they're getting paid, and then it adds whether that duty is performed on duty or while not on duty. So again, intending to clarify that as long as they're acting in their professional capacity, as they're allowed to during the time when they're normally working, they would be able to reap that benefit. So
Okay.
Those are suggested changes from the modified version that was put, or from the version that was put out to the public.
So if there's anyone, this is a public hearing, and has anything to speak, please get up to the mic, state your name and address. Hearing no one, can I have a motion.
We have Eric Rosenberg online.
Thank you. I'm Eric Rosenberg from 15 Bay Road and Chair of the Commission on Aging. Wanted to comment on the proposed ordinance to give some background on tax abatement for older adults in town. We have, according to the U.S. Census Bureau, approximately 2,180 adults age 65 or more who live in town. There was a survey by the Commission on Aging in the fall of 2021, in which 22% of those, a large number responded, 482 people who wanted to pass along to the Commission on Aging and the Town Council their views on their needs. A full 20% said that they could not afford to continue to live in East Hampton. Housing was the number one issue that they talked about, not a lack of affordable housing. And interestingly, although the word tax never appeared in the survey, still a number of people wrote in that they were distressed about their taxes being unaffordable and that the taxes were rising, and they specifically asked for relief. Clearly, amongst your new ordinance that's proposed, many older adults will fall into one of the categories, for example, blind or disabled or veterans. I ask that the council consider additional generosity to those older adults who qualify for specific tax abatements. And I also ask that the council be sure to try to communicate with older adults using multiple means of communication to get through to them about whatever potential tax abatements are available to them and how to apply for them. Thank you very much.
Yes, I'd just like to remind you, that section we aren't voting on tonight,
Oh,
or hearing on. We are further down having discussion on that, and there will be an additional meeting coming up where we have some more approvals, which I think you'll be happy to see. This is more for the emergency service personnel, but
thank you.
Is there
Thank
anyone else?
No.
Okay. Hearing none, seeing no one else would like to speak on this, and have a motion to close the public hearing. Have a second? Second. Motion and a second, any discussion? All those in favor? Aye. Opposed, motion carries. Item 5, public remarks. If you have anything to say about any of the items on this agenda, please step up to the mic and state your comments.
Only on the agenda items or other items? Just to be clear, because you did say on agenda.
Yes, I did.
So.
Any other items they would like to speak about?
They have the letter.
Good evening, I'm Chuck Yankner, 65 Spelman Point Road. I'm also chairman of the Conservation Lake Commission. And I believe the town manager presented a letter from the Lake Commission, Conservation Lake Commission, to you folks about the possibility of acquiring a piece of property on the north end of the lake, which we'd like to see acquired for a couple of reasons. First and foremost, keep it undeveloped so that it doesn't create more runoff issues to the lake. It'll help from the programs we have going to clean up the lake. It could be used for passive recreation. We would recommend passive recreation, hiking, that kind of thing. So I just want to make the council aware of it and say that the Lake Commission has a unanimous vote in favor of it. We'd like to pursue, it's early yet, we don't know exactly what the finances are, but we'd like to pursue folks like the Middletown Land Trust, wherever, see if we could get some money from them to help acquire this property. But for land acquisition, I think it's a real opportunity. It's 30 acres, and there's not very many places in the watershed with that kind of acreage.
Thank you.
Okay.
Any other comments? Item 6, presentation, bids and contracts. Item 7. We have a bid from towing and maintenance, repair of police vehicles.
Chief, you want to run through the bidding process here and give your recommendation for this contract?
Good evening. On February 23rd, we opened up two bids at 11 o'clock in the morning. One was from Belltown Motors and one was from Monaco Ford. The key factors in the bid were Belltown Motors had an hourly rate of 105 and Monaco Ford had an hourly rate of $146. Equally important was Belltown Motors utilizes their own records, and Monaco Ford was going to subcontract their towing to Lamar's Towing, which is located in Weathersfield, Connecticut, which is roughly about 19.2 miles away from the town. And using Google, their average time just to get to the town would be 20+ minutes. Based upon our excellent working relationship with Belltown Motors, a very minimal increase from their previous flat rate of, I believe it was $98. It was my recommendation to again go with Belltown Motors for a 1-year contract.
Great, thank you. Does anyone have any questions? Okay, motion to approve it. So. Motion in a second. Any discussion? Hearing none. All those in favor? Aye. Opposed, motion carries.
Thank you very much.
Okay, resolutions. A consideration of a motion to approve amendment to chapter 278 taxation of the code, the town of East Hampton regarding providing additional tax relief program.
I move that we approve the amendment to chapter 278.
Is that with the additional verbiage from David?
Yes,
Okay, as written as we have.
as written.
Okay, you have a motion to have a second on that. Second. A motion and a second. Any discussion? Hearing none. All those in favor? Aye. Opposed? Motion carries. Now we go to item B, consideration of a resolution regarding additional tax relief. This is the one that Brandon did a whole lot of homework for us. And we came up with a way to help our seniors out with some additional work. And what David did was give us two options of how we want to do this. You want to run through the ordinance and why we're doing this, Dave? Why we
Sure.
it says,
One of the pieces I think that kind of got a little bit lost in our conversations about tax relief over the last several weeks has been this section 12-129N of the state statutes, which really gives the council, I think, some of the power you've been looking for in creating a program of your own design to implement some relief for seniors. There is an option for, or rather, there's a requirement to have a committee of not less than 5 resident taxpayers review that, review any proposed program, understand the financial impact of that, share that with the Board of Finance, and ultimately bring it back to the council. In reviewing that ordinance, or that statute rather, frankly, I see no reason why the council can't, if it wants to, appoint itself that committee, acting as a committee on the whole, if you will. You're certainly all resident taxpayers. There would be more than 5 of you. You'd have that option to go ahead and review that material yourself during your normal course of your meetings. Ultimately, have a subset of you or all of you present that to the Board of Finance, and then bring it back to a final ordinance in the future through the normal process. So what you have in front of you is a resolution to kind of create that process, move that forward for the record. And you have 2 options of language, one that goes and simply says that there would be a committee appointed by the council for a short 60-day term. That's, by the way, in the state statutes, you have 2 months basically to do this. Or the language that I've proposed to you is the town council hereby appoints its entire membership to serve as the aforementioned committee and will serve in that capacity for 60 days in accordance with statute. So you have those 2 options, 5 new people that you recruit off the street, or the 7 of you acting as a committee.
So if we approve this, the 60 days starts today.
Starts today.
So then we should also come up with agreements of what the general, because the state statute also said, once the first one, like, once we adopt the 12-129N. Then this doesn't have to go back to a committee if we wanted to modify it, then it at the town council level and modify it. So if we said, we like this idea where the council I mean, like you said, it is a 5-member tax-paying committee. So if we represented, like you said, the next Board of Finance meeting, we go there and present this, and it just has to be recommended by the Board of Finance. And then come back. Then we should also vote on what the, I guess the new ordinance should be, what the new tax relief program should be then tonight. Also, like, discuss it, because if not, you wait 2 weeks. And then you possibly wait a couple more weeks to go, and then you have to set another town meeting, like, we'd be pushing it really close. That's what I'm afraid of.
You certainly can put a concept out there. And you could do that right away, sure.
And I think, I know, because I know we've talked about it, I think the easiest concept to start now is kind of like with the tax relief, the freeze program that we have. Is I think that's a good place to start, because like I have a couple here from some of the other towns where East had them. So the other programs that they have that we currently establish is where it breaks down. If you make anywhere from $38,000 to it's like nothing a year, you could get a relief of $1,250 a year off your taxes to like $250 off your taxes a year. And then we have the tax freeze program, but that limits you to $38,000 for income, right? And that's what we started talking about. We wanted to increase that to make that more realistic. Some towns did, East Haddam kept the $1,250 off your taxes, but they increased the limit to $50,000. Haddam, they did theirs kind of funny, where they had a tax freeze program, kept it what you were at, but you had to be a resident of the town for 15 years. Their limit was $55,000 for income. They also had a 100% tax abatement program, where then if you chose that, you have a 0% lien and you paid that one back. So there's a lot of ways we could look at this. I even looked all the way, you go down the shore to Essex, and they said, if you qualify for the state's program, we'll double. So you can have $2,500 off your tax, or, tax a year. In a lot of ways, but like I said, and we were saying that once this is approved and it goes to the Board of Finance, committees like the Commission on Aging can come to us every year as part of their review and say, hey, we like this program. We think this should be updated or expanded to this, right from the horse's mouth. So I would say, like, the easiest way to start is, we kind of like this tax freeze program. We could talk about the lien that goes onto it, but keeping that program for now and just expanding the income to $50,000, making it more realistic. Start from there, and then next year, Commission on Aging can review it now that we know it's a simpler process through us, and grow it instead of. We have 60 days, so if we had to present a lot of research to the Board of Finance, like the state tells us we have to, we might not have enough time to get a full report, is what I'm worried about.
Gotcha. So what I assume is, back to the original point, is I assume you're in favor of the second option, where we can sit here right after we make this approval and decide which way we want to go.
Right.
Okay.
And then discuss that. Get the ball rolling, and then next Board of Finance meeting, us collectively, whoever it is from us goes to the Board of Finance, present it, comes back, we vote on it at our next meeting, and then it goes to town meeting, just like we just had for the last ordinance we just adopted.
Tim, which direction do you think we go in?
I think I like Brandon's idea, honestly. I agree. I don't know if we're gonna have pull this together.
I think it's the quickest, fastest way.
I think so too.
Mr. Brown? Mr. Wright, any?
The only question I have, Dave, can we, if we pick the council, can we amend that? And what does that take if we want citizens to do it?
If you,
Tonight, as Brendan's saying, to get this moving, I don't want to delay it. I also have some concerns about the council doing everything. I would rather have more of the community involved in these things.
Well, it's a simple resolution, Pete, so at any point in time, any council can just quickly change it, make their own resolution. Yeah,
Sure, of course it could be changed. I would caution you, though, that if you're gonna start the process, you have a 60-day window. So if you start down a path with the council doing it, I think the council needs to finish it.
Yeah, I agree with you there. I'm just talking about in the future.
In the future, interestingly, as Brandon pointed out, I'm sorry, as Councilmember Goff pointed out, in the future, when you're amending any program you put in place under that particular section of the statute, you do not need to do another committee. It becomes your normal process of approving an ordinance. So again, the council would do any amendments. I think what is being suggested is that perhaps there would be either some formalized or some informal input sought. And amendments in the future would simply be an ordinance change in your normal process of a public hearing associated with that.
Yeah,
The process is much more simple to amend than it is to implement the first.
right, and that's why I said nothing that's really crazier than what program we have in place now. The Commission on Aging came to us when they gave us their review last time, saying that like they kind of just found out about the program, the tax freeze that's here, and not many people can sign up for it.
Right.
So that's the best review process, not really us, it's them coming to us and with data, right? They, like you said, they had a successful survey, they were just talking about it. That's where we get that data and information, and if this is a useful program or not, because right now, this isn't a very useful program.
Eric, you look like you have some comments.
I was hesitant at first with the delaying going as far as I originally hoped we would with it, but after listening to his comments, and if we get it on the books and then we can amend it, we could even amend it later this summer if we felt there was a need to give a little more relief to some of our seniors with a simpler change in the ordinance, but yeah, that would be, I'd be in favor of that.
Allison?
I agree with both sides.
Well, based on everything that I heard, Mr. Chairperson, I have no qualms with the council moving forward.
Okay, so with that, could I have a motion to accept the council taking it at this point in time?
To make a motion to have the town council represent the committee to establish a committee to consider tax relief program under section 12-129N of Connecticut state statutes.
I second that.
And motion and a second. Any discussion? Hearing none, all those in favor?
Aye.
Any opposed, motion carries. So with that, for the next meeting, I assume we're gonna have something we'll be passing on to the Chair of Finance.
Right.
Okay.
That's where we start. If you want, if I brought it up, I mean, I can send it out to everyone here in the town council, have it go to them so we can get the ball rolling.
Yep, sounds good. We'll have it on the agenda for next step, agenda next month, and then we have to take somebody from council to present it to the Board of Finance.
Correct.
It could be all of us, so we'll find out. I don't have their next meeting date or whatever it is. That's what, between now and their next meeting, we start sending out the ideas. We agree to it, you know, through the emails. We're not voting on it until it comes back from the Board of Finance after it's been recommended.
Okay, sounds good. Thank you. Thank you for all your work on that, Brandon. Item 9, subcommittee reports and updates. Water, Mr. Brown.
We have a water meeting. Dave,
There's a lot of
No.
water. That's new.
Uh,
There's a lot of water, and now it's just figuring out how to get to the town is the biggest problem.
So the majority of the conversation that evening was related to the initial steps of system modeling that was done using town-owned property for various storage tanks and dividing the system that's sort of developing has a couple of pressure zones in it, or a high zone and a low zone, as they refer to it, and where those storage tanks might be, where those what elevation, the difference, the break point would be for those two systems to move that forward. So a lot of the conversation revolved around that. And ideas of the commission members, committee members, or amendments, concerns that they wanted to address in the future. We also came back to the conversation of the next public information meeting. You'll recall, I stood at this podium and talked about the fact that the intent was to sometime in the next upcoming month do that. I think the commission made a decision to move the process a little bit farther along, get some better details on the concept of moving ahead before they brought that forward. So I think we're probably talking about a few months from now rather than this upcoming month before we do some public information meetings as an update. Certainly those meetings are always open to the public, but before we do a formalized, if you will, public information. So I think that addresses more or less what was the conversation that evening.
Yeah, just about. I think we both agreed that, because the biggest concerns I know that everyone that wants to talk about is, one, is who's going to get the water, at what time they're going to get it, and how's it going to get there, and two, how's it going to be paid for. First, we got to figure out the whole water system, right? And so before we just keep opening up to more questions, wasting their time and everything, the next time they have a general idea that they gave to us, they said they're going to come up with their 3D, it's like a CAD program that it actually runs, because like you said, 3.5 miles and 500 feet in elevation, the water has to go. So it's a process. So once they get that all worked out, then we recommend they come to us and show that, and then we worry about the other details after, once we have a plan.
Yep, true. But, for those of us who have been around for a while, we know about water in East Hampton. It's expensive, well, in any town, it's expensive. Well, East Hampton needs it badly. It's a selling process. Because some people will get it, some people will not get it. There are areas in this town that desperately need water. We're trying to capitalize on the infrastructure money coming down the pipe to be shovel ready. So when that money breaks, the town has a chance to vote on it. And we have we're building in a process. It's a PR process to inform you on everything to get this moving. This is such a critical point for East Hampton. And I hope everybody gets behind it.
I think that's it from the water subcommittee.
Okay, any other subcommittee reports? Bradley?
I have two, Mr. Chair. First is this Thursday, the fire department building committee is going to have our first meeting. And second, the Bevan Monument Committee. We've agreed that we're going to go with the bench style monument. And this week we are deciding they assured that a bench could be here by Old Homes Day and at a much lower cost. And just about what's covered by what was raised. So, and besides anything else or any other type of money that's going to be raised. So once the styles come in this week and we choose it, then I'm hoping by next council meeting, we can present it.
Very good. All right, thank you. Does anyone else have any other committee reports? Sorry?
Brandon, you said building committee. Is that a building committee for the fire department? Or was it a committee to search for property?
Fire department exploratory
Or
committee for the fire department,
or
a building or property.
I think we have to formally do a building committee.
No, this is an exploratory committee. This is not a building committee, Mr. Brown.
Well, that's.
He said building, but there,
Well,
we never appointed a building committee.
Thank you. That's what I want to know.
No, you're right, quite right. We did not appoint one. It is not a building. It's an exploratory subcommittee to find out the needs, possible uses, possible spaces, that.
Thank you.
It's
Thank you.
informational. Thank you.
Mr. Chairman,
Yes.
I do have something I can add, not to that conversation.
Okay.
But the middle school roof committee did meet on Monday. Mr. Smith shared with us some very positive news. The Department of Administrative Services did send us a letter acknowledging that the application form that was submitted by the superintendent's office was accepted, received, accepted, and we have a go-ahead now to begin the process of replacing that roof and receiving a 53.57% reimbursement rate back from the state. The project is $2,300,000 guesstimate. The project is to replace the roof at the middle school. The next steps that the committee will be taking over the next few weeks. Step one, an architect is going to be finishing specifications and a bid package. Once that's complete and reviewed by the committee, it will be submitted to the State Department of Administrative Services. We've been told it's going to take a good 2 weeks, maybe even 3 weeks for them to review it. Once they review it, if they accept it, then and only then are we able to go out to bid. Once we bid, we will review the bids that come in. That'll take a selected number of weeks as well. Select a vendor and then begin the process. The challenge is that you really cannot do this project during the school year. It needs to be done during the summer. Fortunately for us, the state has given us the opportunity, if we're not able to do it this summer, to do it next summer based on the letter that we received. Obviously, the Board of Education, the administration of the school district would love to do it this summer. It's a very tight window frame. We're talking about tomorrow being March 1st. But our goal is to move as quickly as we can ahead. And the hope is to be able to have that project completed as soon as possible.
Okay, very good. Thank you. Thank you for that. Any other reports this time? Okay, hearing none. Item B, review and discussion possible action on the follow-up request regarding ambulance association operations.
I don't know quite how you want to handle this, but you did get, you asked several questions of the Ambulance Association in response to their report from earlier in the winter or late in the fall. Those have been received and have been distributed to the council, as well as some other information and materials related to the ambulance operations, the emergency operations manual or something of that sort is the name of it. And then you also have a copy of the request that the Ambulance Association made for the upcoming budget year for additional funding in their line. I'm assuming that you want someone from the Ambulance Association to step forward and engage in a discussion with you, but I leave that to you and I will relinquish the vote.
Mr. Chair, I'd like to know what the 173,000 plus would be utilized for.
Is there a member from the association who can answer that question? Good evening. Question is, what is the $173,000 being used for?
I'm sorry. My name is Bob Holdsworth. I'm the consultant for the Ambulance Association. I prepared the report and assisted the organization with answering your question. By the way, thank you very much for those thoughtful questions. We really appreciate it. The 107, as you saw at the end of the report, there's a budget for next year showing the shortfall. The 173,910 is 50% of that shortfall. The other 50% would come from Ambulance Association funds. The plan that was presented was to, in fact, attempt to share the cost for as long as possible. We're estimating approximately 7 years to be able to share that cost with the community, so that we can get through all of the things that are happening nationally and get a better handle on what changes there will be in the industry concerning reimbursement, conversations with other communities for consolidation potential. The $172,000 is part of the budget shortfall. The majority of the expense this year and moving forward is the fact that in order to improve the level of service where there is not sufficient volunteers available to most communities in the state of Connecticut, we are looking at the introduction of per diem staff. So part of it is wages, part of it is administrative costs. We've brought in, the association hired a full-time chief to manage the ambulance service operation. He is also part of a second crew during the day so that there is increased capacity within the ambulance service to provide residents with better ambulance service and faster ambulance service.
What else have any questions?
Mr. Chairman, I just want to compliment the association and of course you, sir. I generated a number of these questions. But I do appreciate the fact that you took the time to be able to go through the process. I appreciate the information that you shared, and I have a much better understanding now of the operation. And based on the way the original presentation was designed, you afforded us the opportunity to ask a number of questions because there were some little items that were just dangling there. And it whet my appetite, and I'm sure a few others, to ask those questions. So I just want to compliment you on the information. I thought it was very thorough, the information provided, and I appreciate that.
Thank you.
Okay, and I understood you right. One of your comments was they're gonna need 173,000 a year for the next
7 years.
7 years.
The way that when I write contracts, and I've written them for several communities, the way that most contracts get written and in the industry is that there is an escalator built into every contract going forward year over year. What the association is attempting to do, they are still actively recruiting volunteers. The budget is predicated on the assumption that those volunteers will not be available as the staff 24/7. The goal is to have an ambulance staffed 24/7 rather than people responding from home most of the time. So in order to do that, where there are not volunteers, the supplemental capacity of per diem employees is the norm within the industry, not only in this state, but nationally. Members of the board attended a meeting on Saturday in Colchester, as did I. And one of the board members' comments was it was important for him to have heard that we are all in the same boat. And there were representatives of about 20 services. So this is a state and national problem, which is a shortage of personnel. And the volunteers are only able to provide as much time as they can. The goal of the ambulance service is to use volunteers wherever possible, but there is a definite need to subsidize with paid staff. And that is the case. Almost every client that I work with across the country is some form of hybrid organization at this point. That when originally was all volunteer. So
I have a question.
Go ahead.
Mr. Chairman, would these employees be considered town employees or association employees?
association boards.
Oh, question or I guess comment. So also included in here, Mr. Cox provided our local emergency medical services plan agreement. So a contract between us and the ambulance association. So I looked this up. I didn't know, and I wish we had this starting last year when we were talking about, like, just in general, a lot of us had questions on response times. What's the standard, what everything, this was never brought up and is approved in 2021. Two things to that. One, the state statute says the municipality is supposed to approve it. So that's one problem, us being the legislative municipality. And two, at the last page or page 19 of it, it does say that this contract is going to be reviewed no less than annually. It's been 2 years exactly since this has been looked at. So I think with these questions, the information you have and where we're at, I would say that the next step that we're at is reviewing this contract between us and revising it if necessary. Especially since this wasn't ever reviewed between us. And I think that's the easiest way to go. We have a contract between them.
Well, when the review process start now? I mean,
It should have started last year and it should have been approved by you 2 years ago.
But we can't go back.
Correct, so we should start reviewing this contract, is what I'm saying, is the next place to go. On our questions,
I'm talking about as part of. If we keep $73,000, we enter into this agreement with the ambulance to keep them going. We're gonna review that now and sign it.
tonight now.
No,
No, as part, yes, this would be part of it. They're asking for more money. We had a lot of questions. This has a lot of the answers when we
Yeah.
said, you know, you have to be there. This, I think it's 17 minutes, 17 or 70% of the time, right? They had more paid if that stat can't be changed. These were the questions we had. If they're throwing in more money now, a 7-year contract type of thing, $173,000. You're right, that definitely should be part of this agreement. And that's why I mean, this is kind of where to start. What needs to be changed between us? And now that we have this document now, or we're seeing it. I think that's where we go.
Well, Mark. My goal is simple. I want that ambulance. I want the volunteer ambulance in East Hampton, controlled by East Hampton. I think they've provided good services over the years. There's a reality here that we're all facing. They have no control. As volunteers.
So is your point, you saying the association be controlled by the town council?
No. And I think with that, we're in a partnership.
Right.
I'm not saying. You know,
I don't think we should add them to the code like the fire department. I think we just need to amend the agreement between the council and them and thoroughly review it there.
I'm saying, yeah, we should look at it. I don't know if it needs amendment. I haven't seen it.
Well, I'm going to the fact that this is starting out like the town of Durham. We're gonna start out at 173,000, within years we'll be up to 1 million. We have a second option that was proposed, was looked at by them and said it is an option. And that is going with Middlesex, which would be a zero cost to the town of East Hampton, not 173,000.
That's not true.
Plus, what's the other 46, 45? How much do we give out in stipends, David?
I think for the ambulance it's 60,
63.
I'm not sure, but it might-
So now we're at
40 to 60,000.
$230,000. Not 173, it's 230,000, the real number. Middlesex would not cost the town of East Hampton 230,000. And also, there's a rumor floating around there, and I don't know who started it, that Middlesex does not go to emergency services. That is not true. That is not true. Durham has Middlesex ambulance. They go to all their emergency services. They pick their people up, they get them to the hospital on time, and their times are faster than we're providing.
Mr. Chairman, may I address that?
Yes,
Okay. The Middlesex program, while an option in the report, has some flaws that you need to be aware of and the council needs to be aware of. When the Middlesex program was put in place, it was designed not to be an emergency response. They don't respond to the city of Middletown where they're based. They don't respond to Marlboro as a backup. They did take on the contract in the town of Durham with one ambulance, and their ambulances do rotate when that Durham ambulance goes out. That is the only area where they are responding to 911 calls, other than mass casualty events. So when Clean Energy had the explosion, there were ambulances that responded and things like that. That is the only 911 part of the contract that they currently do. And when they put their application in for the licensure for the vehicles, And the license that they went for the additional vehicles just recently, it was completely based upon interfacility work to move the patients between their two clinics and the main campus of the hospital. The other part is, while they may or may not give you a zero bid for the actual ambulance service, and that would be dependent upon what you ask for. Replicating, one of the things that has to happen by state statute or state regulations is that in order to replace a primary service area holder, which currently East Hampton ambulance, as of June 30th for 70 years, has been holding that PSA. You would have to petition the state to take that PSA away from them and go through a process where you would present the reasons why, and they would present the reasons they should keep it. The state hearing officer will decide whether or not to approve your petition to remove that. In order to do that, part of that petition process is you have to have a provider that has agreed to provide the exact same service, same or better. And then you have 1 to 5 reasons, as I outlined, that would allow you to articulate which of those 5 you're basing your ask to remove them and replace them with the new provider. So that would mean that Middlesex, in your scenario, would have to have said, yes, we will do it. That they have the resources to do it. And that you would then prevail at the public hearing at the state level. So it's not as simple as a resolution here and we're changing next week. It's probably a 9-month process that you may or may not win. And I just want the council to be aware of what the process is. If that's the decision you make, that's the decision you make. But you need to know how that process works and that process is required.
Absolutely. And from your scenario, that if we don't fund this at 173,000, they will fold. Is an absolute reason why the state would grant you that.
That has not necessarily been the case. And the reason is we are asking the proposal that we put together elongates things out approximately 7 years. The ambulance is still going to go forward with the process and has already implemented steps to put the process in place. But it would shorten that if there is no town participation. If they use all their resources to the point of 0 and then came back in, the ask would be larger and the time frame for that ask would be shorter. So that is something that the ambulance has already committed to on their own. They're asking you to participate with them. And make that go as long as possible. I will tell you, there is nobody on this planet that can tell you what the ambulance industry is going to look like 5 years from now or 7 years from now. Right? We have supply chain issues. Those are likely to get worse if conflict happens with some of the supplier partners. We have an election year that will come up, and that will depend upon what policies get implemented, both state and federally, which could impact reimbursement and grants and funding. What we're trying to do is partner with you in the best interest of the community to elongate that so that we have a good picture of what it is and allow for conversation with other surrounding towns to find other solutions. So that's what the proposal is. But to your point, if Middlesex was interested in doing that, they would have to say yes. They would have to give you a solid proposal that you could present to the state, and you may or may not prevail at the state level.
So my question is, why wouldn't the ambulance association be in talks right now with Middlesex in front of us to have that done?
Because the ambulance service wants to continue providing services they have for 70 years.
So they want to create a paid entity, which is actually not part of the town, like the police department. The police department is paid for by the town of East Hampton, controlled by the town of East Hampton, through our human resource department by the town of East Hampton. The ambulance association is a separate entity that you're asking us just to throw taxpayers' money at without not having any control over whatsoever. I have a problem with that.
Well,
Excuse me.
Chief, let's say something.
Currently,
Excuse me, chief, are you now a paid employee?
yes, I am.
Okay, thank you.
Currently, the town is contributing money each year to Chatham Health District, which they do not have control over, hiring of those employees.
The town is represented on a board that oversees Chatham Health.
Okay. So I just like to point out that there is money being contributed to an outside organization where there is stuff.
Where a town employee has oversight.
Yes, and I certainly believe that in one of our answers that the board provided this week. We did say that that is something we're welcome to doing in terms of having either a council member or representative sit on our board with that. So that was in one of the questions that was represented. Additionally, I would like to speak on council member Goff in terms of the local EMS plan. So every community in the state of Connecticut is supposed to provide a local EMS plan. There's actually a lot of communities out there that currently do not have an updated one. They're not able to provide that. Our last EMS plan was updated in 2016. Prior to that, it was 2002. With the current one being 2021, which was provided in the council information tonight. As Councilman Goff mentioned, it's one of those things that over the years, there hasn't been much review in it, and certainly we're welcome to providing annual reviews with it, going over it, making sure that, our response times are what's on par. And certainly, this is another thing that, we're looking for money to be able to improve those response times and then be able to get that lower and everything like that. So it is something we're very open to in terms of discussing it, seeing how things can improve. And looking back even just to our paramedic service and our other responders to see how can we improve times for our community and other things we can provide. There's also things in the local EMS plan to talk about problems that need to be resolved and how we can work towards them and getting them better. And certainly that is something, like I said, it's a community involved effort, and we want to make sure our community gets the best thing. So I just wanted to touch on that.
Also, it is not at all uncommon in this state and around the country for nonprofit organizations or for-profit organizations to be the contracted provider in a community, receiving taxpayers' dollars as a subsidy. When you asked the question about would there be an opportunity for board participation, we answered yes. The issue is how that board position happens, and there's several ways it can happen, but one of which is a voting member on the board of a nonprofit organization has fiduciary responsibility to that board. So things that are discussed at that board level, while would be knowledgeable, could not be brought back again in a public meeting other than the public minutes of those meetings that will be available. Sitting on the board or a liaison from the council to the board makes perfect sense and relieves that fiduciary responsibility. So the answer is yes. The question is how. Would you want to do that? But there are communities throughout the state of Connecticut. Your municipal obligation is to provide ambulance service, and it can be done through an organization, it can be done through yourself. In the case, we'll take a couple of examples. The towns of Putnam and Thompson have a person liaison to the board of directors for the ambulance service. Taxpayer dollars are paying for the ambulance, and the upgrade was to provide full-time staff to reduce response times. That particular program has reduced response time by 50% by having paid personnel available. The city of New London or the city of Willimantic are town-owned municipal fire departments. So the town actually operates that. The town cannot hold the PSA. The town can buy the organization and control the organization, which goes back to your question. Then those employees would in fact be town employees. Now they are not. So it is extremely common that taxpayer dollars are being used to subsidize something that is required by statute to be provided by the municipality when there is a revenue shortfall from the operations that the organization and the community determine is the service they want in the best interest of the community. So it's not uncommon.
Any other questions?
I do. My goal is to keep the ambulance in East Hampton. We have $173,000, right, Dave, that you put aside in the budget.
My budget hasn't been released yet, but there is a request from the association for an additional 173,000 and change.
I know money is tight. Nobody wants their taxes to go up. You know what I want more? I want an ambulance at my door. Qualified people. We've been fortunate, very fortunate in Connecticut and other towns for years and years, relying on volunteers. They've done an excellent job. The bodies aren't there. They're just not there. So therefore, we have to look at this from another point of view. Don't we still have some ARP money left? I mean, we have money. We have money to do this. It's the will to do it. That's what it comes down to. I think the people in East Hampton, you're right, Mark, about tax dollars going up. I'll pay. I'll pay for a police department. I'll pay for an ambulance service, just like I pay for good school. It's a fact of life. You're not going to get around it. And I think the people in East Hampton love their ambulance service. We've had good service. We've had quality service. I want to keep that. And if it costs 173,000, that's what it costs in this day and age. Consider ourselves lucky for the number of years that it didn't cost us. That's where we're at.
I think you're absolutely right in saying that we're lucky, and I'm not at the point of saying nobody is blind to the fact that, like, no, nobody here is saying we have to stay volunteer. I don't think anyone is arguing that fact, right? We need help. If we call an ambulance, we want to be carried there. My point is now we have a contract that I wish was brought up 2 years ago, a year ago when we started, that we could review some of this data, that we could see, we talk about not be part of the town control or anything like that, but we had a say, more of a say in what we were getting that was agreed between the two that we're now seeing. And also going back to the Middlesex Health, it's not just on that, it's just you are hired by this association to tell us why we should stay with this association. What's different?
Respectfully, Councilman, I was hired by the association to analyze the association in response to the request from the council to please tell us what options we had.
Okay, so just like with any other type of service, especially now when it goes from volunteer to paid, why don't we go out to contract, go out to bid to actually have the information, the data, the contracts of what every provider and whatever can give us? The numbers, the cost, everything broken down. Because right now it's a very one-sided story. And that's the biggest thing. We need a change. I absolutely agree. We cannot sustain this way. They've been saying this for years. It's in every news article. If you look up East Hampton, we're drowning either money or personnel. Not blind to that. We need a change. But I don't know why and when it has ever been that it's just, we don't look at other services. We don't have the information in front of us. And our current agreement that we have is out of date. So it comes back to, we need to start with our current agreement and be able to look at all our other options in front of us. Not just be told, you don't want to do that without that certain association coming to represent themselves.
Any other comments from any other members?
I'm just gonna ask Brandon, do you really think that there's gonna be somebody cheaper than this dollar?
I don't know.
Yes, I know so. I know Middlesex, having personal conversations, said they would take over the town, they would provide emergency service. So floating that rumor out that Middlesex come, they're not gonna pick people up is an outright lie, and I don't even wanna hear that floated. That's not fair to them.
Mr. Fiegel, I don't know, is what I'm saying.
I don't know
This is
either.
what I have,
I
but
mean-
we just voted on the police, the towing and maintenance contract, right, for the vehicles. It's the same type of deal. We like them. You don't just stick with them. Never once have we just sat here and gone, well, we've done it for 50 years. We don't even need to go out to bid to see what the other offers are. That's not what we do. We got a recommendation on who we should keep. We have a recommendation from the people that have been providing us the current service, which is absolutely valid and a reason to look at them and to keep them. But there's also our due diligence to look at all our other options.
No, I see your point. I also see that these people have also done this pretty much for free for many years.
Right, and something needs to change. It
Yeah, well, I
can't
agree.
stay
We,
this
we,
way.
we can't sustain it because, we can't get volunteers for many things.
So
I
why
agree
don't we
with that.
do this like any other process for services?
I do have a question for Mr. Olson.
Yes, sir.
I know that there are conversations right now at the state level, because we're not alone in this issue.
You're right.
And I know that there have been conversations at the state level regarding fee structures and whatnot. Could you take a couple moments to share with us any information you might have regarding what's being discussed and what windows of opportunity that we have not discussed that are now being discussed, frankly, for maybe the first time in a long time? I know it's been an issue. No one's wanted to talk about it, but now it is something they're talking about. It's hit them like a Mack truck.
Yes,
Thank you.
there are several things, a couple things at the federal level, a couple things at the state level. There's a bill that I believe is going to come out of committee to bring the Medicaid rate up to par so that it pays the same as the Medicare rate. That's about $120 a call. As you'll see from the report, the percentage of calls that East Hampton answers that are Medicaid. So there is some additional money that may come out of that. There are three things that have to happen. It has to come out of committee, it has to get passed, and it has to be implemented in the governor's budget for that to happen. They have not done the cost study on that yet for that. So that's one. Second thing, on the federal level, the federal government, Medicare, CMS specifically, is doing its cost analysis. They started it. The idea was they've done it twice over the last 15 years. Both times they did it, they said, yes, the ambulance industry is underfunded, and then promptly reduced the rates. So this is third time. We're all hoping in the industry that third time is the charm. That is going to take another year to gather the rest of the data, and then time for them to implement any changes they choose to make. It was pushed back twice because of the pandemic in getting the data from every ambulance service that gets Medicaid money. So they are looking at those rates. There have been some changes in the last year or so, allowing for patients who are not treated but not transported to be billed. The only insurance company that has kept up with that and is paying for that is Medicaid. So you have a patient in a motor vehicle accident that refuses care, and then the ambulance company does have the ability to send them a smaller bill than it would be if it transported them. No other insurance company other than Medicaid is currently paying it or has it on its rate schedule. Some of the commercial payers are paying it, but it's intermittent and it's not codified. Medicaid has codified it at $80, $82. So those things are all happening. They are looking at a database in the state to allow for a more robust look at response times. To go back to the councilman's conversation about response times, there is no state mandated response time. As I said in the report, there are some industry standards promulgated by the American Heart Association that people try to adhere to. There is a contract that you have, it has some response times in it, that's individually decided and then adhered to. So there are a lot of things that are going on. The goal, if you look at our reports that I prepared, we are looking to not only beat but exceed the response times that are in the current contract. The conversation about going out to RFP, certainly something you could do to see who would reply and who would put forth, the service level at the same level you have. And then at that point, that could be used to then petition the state to change. The conversations that I understand happened with Middlesex, and I'm not putting words in their mouth, this is what I understand, was that they would be happy to come in and provide the service, provided the ambulance service that you have wanted to get out, and as long as they turned over their equipment. So it's really not free. It's $750,000 worth of equipment that would need to be turned over to another provider as a gift to allow that service to come in and do it. And that's just one. The chief is going to tell you about a bid that recently just happened next to you and what transpired. He was at it, I wasn't.
Just a comment, the local EMS plan is good for 5 years until 2026.
Reviewed
It is,
annually.
yes, reviewed
And
annually,
we-
correct.
Did not approve this, even though state statute says the town council or selectmen will approve it. They did not, and it's been 2 years and it has not been reviewed.
Understood. Additionally, the town of East Haddam recently went out and tried putting an RFP out for a request for emergency medical service providers. They had mailed the RFP to pretty much every paid service in our area. Put it out, it was out for approximately 3 weeks, 4 weeks. They received 2 bidders on that, with a total of 3 proposals. So the proposals ranged from anywhere from $400 to $600,000+ for an EMS service, requesting funding from the town to provide that service. Of those services, none of the commercial services provided an RFP back. So Middlesex, American, Hartford Healthcare, ASM or Aetna, none of them provided a response to that RFP.
And that might be true, but isn't that our due diligence to see that for ourselves? I know, I don't, not to sound like a waste of time, but we need to see that. If we have people saying that there is a better option, we don't have that better option in front of us, you're saying we don't. And exactly what you were kind of pointing out, Mr. Holdsworth, is saying that if we agreed that the town, whoever agrees that might not, or there might be a better option, kind of sounds we're stuck anyway, because the way you were talking about the equipment, that even if we believe there's a difference, doesn't mean for the interest of the town, it has to be turned over. Which that kind of sounds like pay us so we survive, or we're stuck.
I'm not sure I would necessarily characterize it like that. The issue is the ambulance association has provided service to you for, as of June 30th, 70 years.
I get that.
Economies and the economics of the business have changed dramatically. The need for resources and staffing has changed. It is, if you go you go from a service that is nonprofit and local, that is partially volunteer, we call it a hybrid service, partially volunteer and partially paid to make that schedule whole. And you go to a service that is completely paid with no volunteers. And in the case, we'll use Middlesex just because it's been brought up in this conversation. There are a different benefit package, a different payroll package, shift differentials. Labor costs are going to be higher no matter how you do it. The conversation, and again, I wasn't privy to the conversation, but I was told by multiple people the conversation happened, was that Middlesex would come in and do it, but required the contribution of association resources to do that. If you went to RFP, and if they didn't come back, did in fact come in and said, we'll do it for nothing, and you said, that's great, $173,000 plus the existing tax stipend, and somebody is going to give it to you for free, I would say 2 things. One, that's great, as long as it's going to continue for a period of time, which you can't control. The other issue with any hospital and the consolidation of the industry right now is that the hospitals are in fact buying up the commercial providers. Hunter's was bought by Hartford Healthcare. American Ambulance is being bought by Hartford Healthcare. Aetna's already owned by Hartford Healthcare. Trinity has bought up Campions and Waterbury. Middlesex is the only hospital that's kind of freestanding in the middle between Yale and Hartford. What we don't know, none of us in this room know, is how long they will in fact stay independent. Obviously, the intention of Middlesex is to stay independent, their stated public intention, but business is business and pressures are pressures. So if in fact something happened, it is out of your control completely because you would not have a seat on the board. Commercial providers in Hartford Healthcare or Yale are not going to give you a seat on the board, are not going to be transparent about necessarily about all of their operation, just your microcosm of their operation. So the real question comes down to, do you want local control that you can see and touch and you can participate in? Or do you want to put it in the hands of an entity that may or may not want to be locally controlled and participate? And if that contract were to not be honored effectively, and I'm not saying they wouldn't, if it were not, you then have absolutely no recourse, because at this point, the consolidation is leaving no other games in town. That's what you're facing. I'm not trying to be doom and gloom. I'm telling you, but flat out, I'm talking to communities all over the state about it. And they're saying, how do we control this? I can't tell you that you can, because I do not know who will by whom. I do not know what happens if a contract is not substantiated and followed, if there are no additional choices. East Haddam went out to bid. None of the expected bidders responded. The reason that Middlesex has an interest here is there's a building halfway between their main campus and the Marlboro Clinic. Right. That's not 911 business. That's hospital business. Sir.
Did the ambulance association of East Haddam, were they behind this, or was this a selectman initiative? Yeah, going out the bid. Was this initiated by the association down East Haddam, the ambulance saying, we're throwing in the towel, we need some help, what can you do?
That was on the select woman.
Okay.
Selectwoman Haynes.
Now, let me make this very clear, and this is why Middlesex and Hartford did not go in. I was told point blank, unless the association wants part of it, they're not gonna come in and step on toes. So that's why they didn't respond, that's why Hartford didn't respond. They're not out to step on toes, they don't wanna offend these people, so that's why they didn't bid. It would have to be this association saying, yeah, we can't do it anymore on our own, come on and give us help, what do you got for us? And then you would see the negotiation start on. That's the piece of the pie we're not talking about. And that's what happened down East Ave. I guarantee it, because that's the conversation I had. We will not come in unless your group agrees to this and wants it.
Yeah, I attended the openings for the RFPs in East Haddam. There was nothing said or stated by Hartford or Middlesex. So I don't know anything. They haven't released anything publicly. So unfortunately, I don't know why they did not put in for it.
The fact that the association down there didn't want it. And the same would happen here. If we went for an RFP, they wouldn't respond, I guarantee it.
And you keep saying local control, local control. Well, right now, we don't have local control. And the local control you're talking about is either if we went with someone else, they could get bought out by a different company, sure. Or we would be back in the same spot here where the local control is, let's say we need a new ambulance and $500,000, we don't survive and we can't provide the care to the town that we need. It's your job to give it to us. That's the local control. It's a hands being tied and having no other choice. So which local control is really better? I don't know. That's why I think for the best interest of town, it's actually going out and seeing what's the best and what everyone can offer. Instead of the hearsay, have it written up to date, what we can do, and this is it.
I do have another question.
All right, go ahead.
I have the local emergency medical service plan. It's the abridged version. I believe it's many, many hundreds of pages. But I noticed here on page 19, the town manager of East Hampton signed this.
Thank you. I said that twice.
Mr. Cox, does that mean that in representing the community, we have some control over this document that you signed?
My recollection of that was that Donald and I certainly, Chief Scranton and I talked about the medical plan and its contents and how it had been approved in the past. I looked back to see what had been done in the past in terms of how the council handled that. I didn't find evidence of a council meeting, and in the effort of moving it forward and making sure that we continue to have an up-to-date plan as we can have, I executed the agreement. I don't know that that constitutes actual control, I'll be honest with you. I think that really more means that we were at least a participant in getting I'm checking a box for a requirement to how do we handle the ambulance that we've decided to have.
And did the previous plans have that page 19 attached to it, or is that something? that
Similar version of
You and
it,
the
sure.
chief created?
I think it's
This,
similar
this is
version.
this whole plan is created by the state. There's a toolkit on how to create it. And that's what it says.
Similar versions of it would have been included in the other.
It talks about what's required when you do create it.
No, I understand that, Counselor, I understand that very well. But I would like to just better understand what would have looked like for earlier versions. Did the town sign off on this document previously?
Sure. Of
Thanks.
course.
Yes.
The other, elephant in the room is the budget that we're putting together. What I see what Councilman Goff is saying about a review, I'm a little leery that I want some kind of assurance that $173,000 that's currently or in the proposed budget stays there. I don't want to be at this table at the end of the budget process. Face this, oh, we don't have the money, it was cut out.
Oh, Mr. Brown, I'm sorry, but that very well could be reality.
Well, but it doesn't have to be reality. It doesn't, let me finish. It doesn't have to be. It's a reality we would create.
It's reality that the majority would create, Mr. Brown.
That I
The
didn't
majority
say,
can make the decision on what goes in the budget.
You're right.
Yes or no?
I can count, Mark.
Okay,
I can count.
then that's what we
But
need to
I'm
know.
saying, so the plan is to get rid of the $173,000 and never have a chance to put it towards the ambulance.
Because
Is
right
that the
now,
plan?
because I don't have a budget in front of me right now, Mr. Brown, I cannot make that comment.
Oh, you can't, but I can make a comment that I would say to the people of East Hampton, I will keep that money in there.
That
Or
is
the ambulance association, should we go down this road? Or better still, why don't you take the ARP money, set that aside for it?
Those are your opinions. You can express those when we have budget.
I'm just saying.
Is there any more discussion on this item?
Yeah, I will just say, since we're all throwing our piece in here, the ambulance association has been amazing for a long time, and I would love to see them say, and if we did decide to help them with funding, you talk about local control, I would have a very hard time. This isn't our money, this is the taxpayers' money. We're gonna give you someone else, we're deciding to spend someone else's money and give it to you. And the town actually has no control over this. This is basically becoming a business that we are subsidizing. I would much rather see it under a liaison is not control. So thank you for that anyway, but it would have to be line item budget under the town council, town board of finance control, if we're gonna subsidize it that heavily with taxpayer money. I couldn't in good conscience spend the taxpayers' money without the taxpayer being represented.
Understood. When I say local control, you participate, going back to your point, you participate in the creation of the local emergency plan. You participate in the parameters of the contract and the expectations within the contract as it is to be reviewed, which makes perfect sense, to make sure that there are things that should or should not be in there. The answer to the question was yes. Putting someone on the board in any one of three fashions, certainly something that the ambulance association is open to. The other thing that I would,
That's that.
well,
It would be a
control.
board of finance.
Control under the regulations is ownership. So if the proposal is to own the ambulance service, that would be a matter of purchasing it and acquiring it and making it a town department. If that was something that the ambulance association was amenable to. And then in which case you would then have town employees and all the rest of it goes with it. The obligation, the statutory obligation is to provide an ambulance service in this town. So you do have say in that. You do have the say to go and petition the state and say, we don't like the provider we have. And you have to prove that there's a better option available. And that organization, whoever that is, has to agree that they will
I'm
maintain.
not talking about bringing anyone else in. I'm talking about the association is asking for money. But we don't have any say over their line item budget, how that money is spent. It's not our money, it's the taxpayers' money, and the taxpayer is not represented dollar for dollar how that money is being spent. That is my concern.
That is common, and I will say that,
I don't care if it's common.
I understand. But if you have an organization, if you have any other organization that
Have
comes,
no say over how it's being spent.
You're saying that our local control is, we can ask, but it does not have to be received.
the same, whether it's the East Hampton Ambulance Association, Middlesex Hospital, Hartford Healthcare, or the Colchester Fire Department. Doesn't matter. Unless you are the owner of the of the organization, the amount of control is to be discussed. The transparency is to be discussed. It's something in a contract that can be negotiated. However, ownership has to happen and total control has to happen under state statutes. If it wasn't East Hampton and it was someone else that came in here and needed a subsidy, as many communities subsidize their EMS system. Right? You would not have any more control, you would have less. The ambulance association is willing to say, please come, participate. We want to be forthcoming with things. So pick any other public safety organization.
Yep.
Do you fund the fire department? I just want to ask a question. Do you fund the fire department?
Yes, and they give us a line item budget every year. We go
Okay.
over where every dollar is spent
Okay,
and
that
we
can
approve it.
That can happen.
Okay, all right, everyone, thank you for your time. Thank you for this along.
We have the ultimate control because we go through a budget process. We either approve the money or we don't. If we felt the ambulance association was misappropriating funds going to Bermuda, we as an organization said, we're not going to give you any money. We don't like that. So we have the ultimate control.
Okay,
We
thank
don't
you.
have to allocate those dollars.
I just have one other thing, Mr. Chairman, if I could, and I just want to seek some clarification. Because it's possible the funding wouldn't be in the budget. Is it safe to say then that the ambulance association will continue as it has? And instead of a 7-year plan, it becomes a 5.5-year plan?
More like 3.
Or
More like 3.
more like 3? Okay, thank you.
Thank you. Item 10, new business. Consideration of possible action regarding pavement portions on approved roads. Matt, I think this is you.
Good evening, everybody. Thank you for having me tonight. Matt Walsh, Public Works Director. I'm here tonight to just discuss a couple small paving projects I'd like to do on on 2 small sections of our gravel roads. This is utilizing funds from our unimproved roads account. The first road being Old Clark Hill Road. If you're not familiar with it, it's that kind of very small road that goes up steep off Clark Hill. There's a very steep gravel hill that goes to the top that always washes out in storms. We have to sweep it out down in the intersection of North Main Street, Lake Drive all the time. So I'd like to pave that section from the end of the current paved part of Old Clark Hill just to the top of the hill to eliminate the washouts and kind of reduce our maintenance there and also help out the lake watershed. I know that's one of the projects that's been targeted there. To kind of reduce those sediments flowing down into the drainage system. It's approximately 486 feet. And then the second one is Bear Swamp Road, which is over by bowling alley, off 66. Again, it's a very small portion that just constantly gets potholes and rutted from the trucks going in and out of Arrow Fence. The bowling alley's back there. He's done a nice job with his parking lot. His parking lot is constantly getting covered with gravel. So we're in there a lot, just trying to keep it passable for the amount of traffic that it gets. And then also you get a lot of gravel kicked out on Route 66. DOT has called us times from that to come clean that up. So again, a small project, but I think both of these will have a large impact on our maintenance, reducing that, and just as a whole, just betterment for the community.
And basically, you're just shifting some funds around to use this. You're not looking for any additional appropriations.
Nope, this money's already in there, and I'm really only coming to you guys because I'm turning dirt roads into paved roads. I just want to make sure that you guys are okay with that. Because it is a change.
I don't have a problem. I think it's a good idea. Yes.
If we pay this, what does that do to our reimbursement?
So there would be.
Let me answer that.
Oh, go ahead.
The finance director and I did that math in response to that question you asked me offline. The change in the mileage is so infinitesimal. It doesn't generate a change. We calculated the percentages to 16 digits beyond the decimal and could find no change. So it is so infinitesimal, it doesn't make a change.
Any other questions?
No.
We have a motion to approve.
So moved.
Motion is second. Any discussion? Hearing none. All those in favor?
Aye.
Thank you. Thanks, Matt. Item B, consideration action regarding police department policies and general orders. General order 1-3, 2-7, and 6-6.
As usual, I'll invite the chief up.
Go ahead, Allison.
Well, I was gonna make a motion to approve it since I don't remember.
All right, go ahead.
I move that we approve general order 1.3, general order 2.7, and general order 6.6.
Second.
We have a motion and a second. Any discussion? Hearing none. All those in favor?
Aye.
Thank you. You're welcome. 11, Dave, town manager report. Do you have anything you'd like to add to what you have written?
If I could just highlight two things that are in there, both related to the police department. First, I just want to mention to everyone that in the written report, we identified that the police department, along with the new armed security officers for the various schools, worked together and participated in an active shooter drill at one of the schools. This is something that the department has been doing for a number of years and has continued to do as a practice for that horrible and horrific event that may occur, so that we're prepared as we can be in responding to those events. So that was a good event, a good training session. I think they did it. They were there for a day on a day off from school and did 2 sessions, and I think it worked very well for everyone involved. The other thing I just wanted to mention to the council and to the community, that the various reports that the police department has to provide to the state and other agencies and to you every year were just filed this recently, and that covers the uses of force in 2022. These are all 2022 activities. The uses of force, the pursuits that we had, and then a report that's unfortunately named bias-based policing. It's really a report to generate, or rather, it's really a report to show how you're not employing bias in your policing, but that report was issued as well, which identifies the apparent racial and ethnic characteristics of the persons that the officers are pulling over. And hopefully those are proportionate to the community, which in review, I believe for the most part they are. So I just wanted to highlight that those reports have been filed. They are attached to the report for any member of the public or anyone else who wants to see them. And certainly the chief is available if anybody has questions about it. So those are the two I wanted to highlight.
All right, thank you. Any questions from the town manager? Hearing none,
Thank you.
under appointments. None tonight. Tax refunds.
I move to approve tax refund of $1,354.19.
Have a motion and a second, any discussion? All in favor?
Aye.
Opposed? And motion carries. Item 14, public remarks. If you have anything to say, please come up and state your name and address. One thing, nope, no hands up. No hands up. Okay, hearing none. Communications. We don't see any before us this evening. And with that, can I have a motion to adjourn? So moved. Second. All those in favor?
Aye.
Opposed? Motion carries.